Booking appointments online, logging into patient portals, virtual visits, managing prescriptions through apps. It is clear healthcare is becoming more and more digital in 2026. But some new research shows that some older adults say, hey, we're feeling left behind in all this. So here to break down what that means for patients and maybe what needs to change is Emory Health Policy Professor Ilana Graetz. Ilana, good morning. Great to have you.
Good morning. Nice to be here.
So there's this new CVS Health study we're looking at here. Nearly 6 in 10 older adults say they struggle to manage their own health. And then when I list all the ways that our health is now digital, I guess you can kind of understand why, right? Does that number surprise you?
It's not surprising because since COVID, access to virtual care has really skyrocketed. Every healthcare provider is relying more on telehealth, patient portals, and different digital tools. And they're not always easy to navigate. And I think the challenge is, may be more prominent among older adults, but it's really for all ages. I mean, people struggle with navigating these digital health tools, knowing how to use them and what functions are available, being able to access them, just logging in and figuring out like the password process with like new authentication requirements, and then just challenges with privacy and trust, like feeling secure with how the data is going to be stored, used, who's going to be shared with. I think those are all real challenges that health systems need to address.
I'm of the younger generation, but sometimes I just want to pick up the phone and call the doctor's office with a question, and now I got to have a talk with an AI chatbot before I could ever even get through to a human. So, I mean, what kind of real-world consequences can this have on somebody who's just trying to get an appointment?
Yeah, and that's something that came out in these results and with other research that people have done, is that there is a small but consistent proportion of adults that really prefer in-person care or being able to talk to someone live over the phone. And so I think what's important is to maintain all accesses, all modalities, channels open to people and not limit them and force them into this digital health platform for everyone. Like, you always need to be able to have a phone number with a live person available to help. And if you don't, I think digital health tools can really start to become a gatekeeper to care, and we don't want to do that. We don't want those tools to limit access to care. We want them to expand access to care.
Yeah, it's kind of a fine line, right? Because these digital tools can expand access in a way, but how do you make sure that telehealth and apps don't accidentally create like a two-tier health system?
I mean, I think let's make these digital health tools easier to navigate, easier to access, like just simpler designs, making clear like what's available in them, and B, make sure that we maintain, phone access available with a real live human, in-person visits available for the patients that need them, and not cut out any channels. But also we need to support older adults and all adults in really improving their digital health literacy with education, with outreach, with customer support. All of those things are going to be really important.
And I guess it's important now because by 2030, all baby boomers will be 65 plus. I mean, that's 1 in 5 Americans we're talking about here. So in a way, time is of the essence to get everybody trained up and ready.
Yeah, it's true. And I think with baby boomers, like with younger adults, I think they are generally very comfortable engaging with technology, which is consistent with what we're finding here. And so now I think the onus is on healthcare systems to really improve their design and training and support for the tools. But yeah, and there's a large number of aging adults with very high healthcare needs, and digital tools can help. And so we have to do everything we can to make sure that these tools are accessible.
I mean, I thought it was kind of interesting in the study. 86% of older adults say, hey, we're open to using these digital health tools. I mean, a lot of my father-in-law, like 10 years ago, didn't even have a flip phone. And now he's navigating his My Chart on his smartphone. I'm very proud of him. I mean, at this point, you're not going to put the genie back in the bottle, so we all just kind of got to get used to it, right?
Yeah, and And I think for aging adults, like digital health tools and telehealth is also really help support, like if you have an aging parent and your kids live like in different locations, like it's really easy for children caregivers to like help manage care for older adults. And so that's definitely an advantage of digital health tools if you can get the patient on board. I think it makes it easier to access and manage healthcare data.
I think you kind of talked about it some when we were discussing what's the solution here. I mean, you mentioned simpler design. It's helpful to have a phone number available to folks who, at the end of the day, are going to need an 800 number or just want to give the doctor's office a call. But is there any more we could be doing to helping these folks out who aren't as digitally savvy? I mean, what about family members who are caring for the older generation? Anything we can do?
Well, I mean, the other limitation here is access, right? So making sure that people have affordable access to devices, to broadband, internet, to data plans. I think that is going to be really key. And then it's just education and design of the tools. But I think, making them easier to log into, easier to share, and be able to get support when you need it from both like customer service support, technical support from the platforms, but also from family members who are willing and able to help and maybe more comfortable with the technology.
Ilana Graetz, important topic this morning and a good discussion. Thank you for your time.
Thank you so much.
You're welcome.